This presentation will address the focus question, how is injury rehabilitation managed? It will focus specifically on return to play, and this is the first part of a two-part series. The presentation will address the following dot points: indicators of readiness for return to play, specifically pain-free and the degree of mobility, and monitoring progress pre-test and post-test. What is required for an athlete to return to play? If an athlete returns to training and competition too soon after an injury, they run the risk of re-injury. Even when an injury is healed, there are specific measures that need to be taken to ensure the injury does not recur. In some instances, medical clearance must be given before an athlete can return to play. For example, a boxer who has been knocked unconscious on several occasions will need a medical clearance before returning to the ring. So just what is required? A rehabilitation program, pre-injury fitness and skills, athlete, medical staff and coach all in agreement about the condition of the athlete and their readiness to return, and confidence on behalf of both the medical staff and also the player themselves. An athlete should never apply pressure to a coach or doctor. Before being allowed to return to play, an athlete must be pain-free. They must have normal and full range of motion. They should ideally have full strength, and they should have an assessment by a medical practitioner to determine their readiness to return. Indicators of readiness to return to play. If an athlete has undertaken a rehabilitation program successfully, an injured area should have returned to its normal functioning. An athlete is ready to return to competition when they are able to perform all the skill and fitness components of their sport. The injured area should have elasticity and flexibility of the injured muscles. Strength. The new tissue is strong and able to support the body in stressful movements. Mobility. The athlete has gained full movement, particularly in terms of agility. The injury is pain-free during both light exercise and strenuous work. And balance. The injured person is able to balance his or her body on the injured limb. Until this function is achieved, the rehabilitation process is not complete. If we consider these concepts in relation to a medial ligament injury of the knee, we need to understand that before the athlete can return to play, they must have pain-free and full range of motion. So the injured knee should have full movement and flexibility with little to no discomfort. Return of strength. The injured ankle should be equal to the opposite side before returning to full activity. In terms of pain and swelling, some mild discomfort, stiffness and swelling may be expected during the initial return, and this should be treated with RISA. Functional retraining is important. The athlete should be able to perform the specific motions and actions required for the sport effectively before returning to activity. So for example, if it was a basketball player who was experiencing this knee injury, they would need to be able to move side to side, move up and back, accelerate, jump, land, catch and pass, shoot, etc., without experiencing too much pain and with full range of motion. The mental confidence to return to play is very important. The athlete must feel that the injured knee is ready to perform at the required level. If the confidence of the athlete is not there, then clearly their performance will suffer. And they will experience a higher risk of re-injury. Monitoring progress pre and post-test. To ensure the injured area has returned to its normal functioning, conducting sport-specific tests will provide both coaches and athletes with information on the athlete's fitness and skill ability. Using a test specific to the sport, such as a beep test for a hockey player, can give an indication of how their fitness and skill level is progressing after the injury. The test will also place the injured area under competition pressures to see how the body responds. The physical condition and psychological condition of the athlete should be monitored when the athlete returns to play. This can take place through observation in training, and the coach or trainer would be looking to see whether the athlete can sidestep or tackle effectively. It could also be observation of video footage that may occur in training as well. Through interviews and discussion, coaches can really tell how the athlete feels and whether they are confident enough to return to play. Through ongoing testing, this could be fitness testing or skills testing, and basically the coach trainer will compare their current status with their pre-injury status to see if they can return. It could also just be through general performance evaluation, so the coach might have a checklist of things that they're looking for that they could tick off to see whether their athlete has returned and recovered totally. And it could also be visits to medical professionals. The athlete should continue to follow the advice of coaches and medical staff until performance has returned to pre-injury levels. Ongoing therapy is advised. There are a number of physical tests to indicate readiness to return to play. Basic jogging and sidestepping, passing and catching are all quite basic tests to indicate readiness to return to play. A test like a shuttle run is a little bit more complex and demanding for an athlete to see whether they can meet the demands of a sport. A 50-metre sprint, again, a little bit more demanding, a little bit more intense than just a jog. An agility test mimics games such as basketball, netball, rugby league, soccer. If you can change direction quickly without pain, then generally you may be able to return to play. A 2-on-1 drill is a drill. You can see we're becoming a little bit more advanced here. A 2-on-1 drill involves opposition. So with the opposition coming at you, can the player make decisions? Can they still use their agility and perform to the standard required? And then the last one is a modified game with full contact. If an athlete can participate in a modified game, this means that they are ready to return to the standard of competition. So they can sidestep, they can catch the ball, they can make tackles if it's a contact sport, okay, and they can really execute all of the skills required. There are a range of fitness tests that could be used to determine readiness to return to play. The first one is a progressive shuttle run. This measures cardiorespiratory endurance. Now, if an athlete had a lower back strain, had a leg injury, this test really could determine whether an athlete has recovered sufficiently, okay, and it's a good measure of general fitness. The Illinois Agility Test is a standardized agility test. It measures an athlete's capacity to change direction quickly. This would be suitable for an athlete returning for a knee or ankle injury or a hamstring strain. The 50-metre sprint test measures speed. Again, this would determine whether an athlete's recovery is sufficient, particularly after an injury such as a hamstring strain or a quadricep strain. A push-up test measures muscular endurance, and this type of test could be suitable for someone that's sustained a shoulder, wrist or arm injury. A hand dynamometer test or a grip strength test. This test could determine whether an athlete is ready to return after a hand injury or fracture or a wrist injury. A vertical jump test measures leg power, and this could be suitable for an athlete returning from a knee injury, an ankle injury or a muscle strain. The ruler drop test or an SVT light board test measures reaction time, and these tests could be suitable for someone returning from head injury, a ligament injury, fracture or strain. The alternate hand ball toss test measures coordination, And this could be coordination after a joint injury, such as that occurs in the shoulder, or an arm injury, or it could be after a head injury to determine whether an athlete has the coordination returned following that injury. The balance board or stalk stand test measures balance, and these tests are often used for those returning from knee or ankle injuries. And the sit and reach test measures flexibility, and this would be useful to measure the elasticity and flexibility of the hamstring following a hamstring strain. Game-related drills and modified games are very useful to determine whether a player can return to the game. These types of tests really determine whether the player can make decisions under the pressure of the game. These drills simulate game speed, and they determine the level of fitness and recovery following injury. Whilst the other tests are very helpful to determine the components of fitness, these types of drills are very, very useful in really determining whether a player can cope with the pressure of a game situation. Examples of game-related drills and modified games could be a 2-on-1 drill, a 4-on-3 drill, a 7-on-6 drill, or just a modified game where players are asked to perform skills that are very, very similar to those that occur on the field. Now, it is important to know that each of the tests that I've just gone through with you can be used to monitor the progress of the athlete as they move through the rehabilitation phase. So at each point in time, a coach or trainer could use any of those tests previously to determine the progress of the athlete, to determine whether they are actually improving and whether they are moving to a point close to their pre-injury levels. Now, it's important to consider the key question here. We're asking you to evaluate. Evaluate means make a judgment of value based on criteria. So we're looking for you to say whether something is effective or ineffective, significant, important, and so on. We're asking you to specifically address the skill and other physical tests that we've mentioned. Now, I have mentioned a range, so you will need to refer to quite a few of those in your response. So we're looking for a range. All of those that I've mentioned that test the components of fitness, as well as those that may be game-related drills or modified games. Now, each of these tests can be used to compare pre and post test, and they're used along the way to determine the progress of the athlete to see whether they're heading towards pre-injury levels. Now, they are also used to determine readiness to return to play. Now, just getting back to the language that you should be using in a question that asks you to evaluate, which is making a judgment of value. Words such as significant, important, effective, considerable, pertinent, paramount, and integral are all words that indicate that a judgment is being made, a judgment of value. So, for example, you could, if you're going to evaluate the sit and reach test, you could say that the sit and reach test is an effective test to determine the elasticity and flexibility of the hamstring after a hamstring strain. Now, if a coach or trainer were to consistently use the sit and reach test throughout a rehabilitation program, they would be able to tell whether the athlete is responding to rehabilitation and whether the hamstring is regaining its range of motion and flexibility throughout the rehab program. So the results would constantly be referred back to either pre-injury levels or to pre-tests that have been done previously. And this would be able to tell you whether the athlete is improving and getting towards their pre-injury levels. Now that concludes this presentation, so please be sure to tune into the next presentation, which is part 2, and you will need to make sure that you watch that. So I realise that this one is quite a long one, and the next one may be a bit of a long one as well, just because this part of the syllabus is very, very detailed and requires quite a bit of thought and critical thinking. So thank you for listening.